Good morning. Welcome to the LeadingAge Virginia Coronavirus Weekly Member Call. Thank you so much for joining us. This is Dana Parsons. We've had quite a bit of activity in the recent week regarding the vaccine, so we're very pleased to have Michael Magner join us from the Department of Health and Dr. Jonathan Evans to provide us with some updates and answer some questions for us regarding the vaccine. Before we begin, I want to let you know that we do not have any member calls scheduled for the remainder of the year. Those will only be planned on an as-needed basis if there are any developments, so we would be sending out alerts to that effect. So let's go ahead and get started. So I want to welcome Michael Magner again with the Department of Health. So over to you, Mike.
Hey, great. Thank you, Dana. So the real exciting update. So since I last talked to you guys about 2 weeks ago, the FDA has in fact improved the EUA authorization for the Pfizer COVID-19 vaccine, and that occurred this past weekend on December 11th. So that's pretty exciting news. So we've been preparing, from the health department side since July for the receipt and distribution of vaccine, and it's been an exciting time. The information has been continually changing as new information becomes available about the vaccines, about the process, and CDC continues to refine and revise their plans. So we've been working to keep up. Uh, do have a couple of links on the slide deck for the fact sheets on the emergency use authorization. So normally with a vaccine, you have a vaccine information statement, but when it's authorized under an emergency use, then you have an EUA fact sheet. So that's the different terminology, but those fact sheets are available. There's one for the healthcare providers that are administering the vaccine. This one is pretty long and detailed and provides a lot of specific information that you need to know as a provider. And then the fact sheet for recipients, these are the fact sheets that you give out to the recipients and or their caregivers when you give them the vaccine. It's a simpler document that just tells them what they need to know as far as vaccine safety and what to expect in terms of potential side effects and that sort of thing. And then also, with the FDA approval, the CDC's Advisory Committee on Immunization Practices met on December 11th. They provided their recommendations on where to get or who should get the vaccine. And I've got the link to the recommendations specifically on the slide here. And the MWR article that goes along with it as well. But recommendations, the vaccine is currently approved and recommended for adults and children over 16 years or 16 years of age and older, I should say. And that it should be prioritized for healthcare workers and staff and residents of long-term care facilities. And that falls under their phase 1A. That's no change from what they previously put out. We still don't have more clear guidance on the phase 1B essential workers group, but we're hoping to get that when they meet again this weekend. The next slide, please. So just updating you on the long-term care facility pharmacy program. I briefed you previously that on November 6th, VDH asked Health and Human Services to opt in all of our skilled nursing facilities and assisted living facilities for this program. We sent them a list of all the licensed facilities. However, as of December 11th, we had 1,268 facilities that were matched with a long-term care facility. 14 were pending match for data corrections, and 165 were listed as opted out. And this was erroneous because we had specifically opted them in. And so we're working with HHS and CDC to get this resolved, and with the CVS and Walgreens pharmacy partners to try and resolve the situation for those 179 that haven't been matched up with a pharmacy program. And I understand there's even one or two that weren't included on that list that we're working with as well. And as we get more information, we'll continue to keep you posted. It's important to note that states had to activate the long-term care facility pharmacy program before it becomes live. And Virginia made that decision to do that on December 14th. There are very technical reasons I don't want to get into why we couldn't do that earlier. However, once that program is activated, then it actually begins 2 weeks later. So the earliest that CVS and Walgreens will begin vaccinating, skilled nursing facilities in Virginia will be December 28th. Next slide. So what you can see on this map is that a lot of states are activating their program at the same time. So most of the states are going to start on December 28th. Some of them are using the Pfizer vaccine and some of them are using the Moderna vaccine. Virginia is going to be using the Pfizer vaccine for this allocation for a couple of reasons. One, the FDA and the ACIP both recommended that this vaccine be given to adults 65 years of age and older, and that it's safe for people even with various medical conditions. And so that's one thing. And the other thing too is that our CVS and Walgreens partners have assured us that they can handle the ultra cold vaccine. So it really made a lot of sense for them to use the Pfizer vaccine. The other good thing about it, and this wasn't a big consideration, but because the shots are only 3 weeks apart, you actually finish your vaccine series a little earlier. Next slide. And so just more updates on the pharmacy program. CVS and Walgreens have begun to contact the facilities directly to schedule on-site vaccination events. As of yesterday, some of them actually began some preliminary contacts previous to this past week, but their actual start date was this past Monday. Again, the CVS and Walgreens will provide end-to-end services. That means they will, order the vaccine, they'll receive the vaccine, they'll store the vaccine, they'll deliver it to the site, they'll administer the vaccine, they'll complete all the vaccination records and reporting. I didn't put this on the slide, but as these these pharmacies reach out to your facilities to schedule these events, they will have some further instructions. They will ask you to gather consent forms, or actually they'll send you the consent forms and ask you to have the patients or their caregivers fill out their consent forms. And then each facility will get 3 visits as shown on the next slide. And this is the same, this is no change. So, again, day 0 is the first date that they come out to your facility. Day 2 is the second date that they come out to give dose 2 of the vaccine. However, they will give out dose 1 to any new staff or admissions that did not receive the vaccine on day 0. And then they'll come out a third time, what we call day 42 or 56. For us, because we're using the Pfizer vaccine, it'll be day 42. And administer the second dose for anyone who has not gotten their second dose yet. So I think that's it. There might be one more slide. Yes, that's right. So just some general reminders. The vaccines do provide their full protection at about 7 days after the administration of the second dose. So if you think about when you're starting the vaccine, you may start it as early as December 28th. But the soonest that you could have full protection would be 7 days after the second dose. So 4 weeks total to be fully immunized and protected. So long-term care facilities should continue all of their current COVID-19 infection prevention measures and precautions even after vaccinations begin. And even after that, until further notice, we do expect NHSN to give us some more guidelines in the future once it's shown that most of these facilities have gotten vaccinated and we see good uptake. And so, along with that, there are the current COVID-19 testing requirements that are based on community percent positivity and testing of staff and residents on, depending on the positivity rate, whether that's weekly or less often. But those testing requirements will continue. Again, the COVID vaccine should not interfere with any of those testing requirements unless you're using an antibody test against the spike protein. But it should not affect the antigen test. It should not affect the PCR tests. And then, positive viral test, if performed, should not be attributed to the COVID-19 vaccine. Again, the vaccine does not influence the results of these tests. So that's pretty much it. I think the chat, I see there's some questions that have been entered or, no, okay, there's Dana's comments to everyone. So I don't see any questions, but I can, I guess, take some time for questions if there's time, do you think, Dana?
Yes, thank you. I did want to mention regarding the update that the Department of Health provided yesterday about Pfizer being the choice of vaccine initially. Could you comment on that?
Yes, I'd be happy to. So I think I might have said on this forum 2 weeks ago, and I can't remember, that we had designated Moderna vaccine for the pharmacy partnership. And that was incorrect. I think we were leaning in that direction at the time, but that had not been decided. When the Pfizer data came out and was shown that it was very safe and recommended for people over 65, and we had the allocation on hand to do it, and we had assurances from our pharmacy partners that they could handle the Pfizer vaccine, we made the decision to go ahead and allocate the Pfizer vaccine for those vaccination events. So I apologize if I said something previously that's caused some confusion or consternation. I'm not sure if people have a preference for the Moderna vaccine or the Pfizer vaccine. But based on what we know now, we went ahead and allocated the Pfizer vaccine.
Great, thank you. I see we do have some questions coming in, Melissa.
Just one, and it's any update on whether independent living residents will be included for CCRCs?
So this is Dana, and I can comment on that. And Mike, if you could let me know if you have any updates or changes to what I say. My understanding is that it has not been included within the prioritization from the Department of Health. However, there is support if there is excess of vaccinations for those folks that choose not to move forward with the vaccine in the nursing home or the assisted living, that each community should work directly with their pharmacy to find out if the independent living on their campus can be included in the vaccine um, distribution for the day that they're on site. Is that correct, Mike?
Yeah, and that's correct. And I'll expand a little bit more. So
Okay, thank you.
the very first facilities that are going to get vaccinated in Virginia are the skilled nursing facilities, followed by the assisted living facilities. And I understand that we have lots of different CVS and pharmacy stores throughout the state. So even though it seems like a lot with 1,268 on the list and potentially 179 more that we're trying to get added, it seems like a lot, but they're going to be dividing and conquering. So they do expect to be at least starting some of the assisted living facilities on their first dose before they have to go back to the skilled nursing facilities with the second dose. Um, so there may be a little bit of a time lag. So just because I say this is going to start December 28th doesn't mean that every facility is going to get vaccinated on December 28th. It is going to occur over several weeks. And then once they get done with the nursing homes and the assisted living facilities, then they'll go back through and finish up any other facilities on the list. Um, any allocations that they don't use will come back to the state. But we're not going to leave anybody in that group behind. So, we'll continue to work with not only the CVS and Walgreens, but other pharmacy partners within the state to continue to address the needs of all the facilities, including the group homes and independent living. It's just that right now I don't have a concrete plan for those facilities that weren't included in that CDC prioritization that I can brief today. But obviously, it's our goal in Virginia to protect and immunize everybody that we can, and especially those in the priority groups.
And could you comment about HUD Section 202 communities? We understand that the CDC Advisory Committee on Immunization Practices did vote to include Section 202 housing in that first 1A distribution.
Yeah, the ACIP, decided to include them. However, CDC, when they created this pharmacy program and contracted with these pharmacies, they did not promise to include all of them. I think they gave those facilities the opportunity to try and sign up, and in some cases they included them, in some cases they didn't, depending on the workload. But again, we're going to have to work as a state to address any shortfalls that the pharmacy program, ends up leaving us.
We've had some more questions come in, Mike. Will hospitals be offering the COVID vaccine to their newly admitted patients?
So right now during phase 1A, they will not be administering vaccine to their patients. They were only going to be taking care of their workforce. I do expect in the near future that they will start doing that for their various patients, offering it to their patients that come to the hospital, not just admitted patients, I'm sure other patients as well. But right now, nobody's doing that to my knowledge.
Yeah, and we were on a call with the Hospital Association yesterday, and they confirmed that it was just for their workers right now. So thank you. If you have residents in your nursing home that are younger than 65 years old, are they still eligible for the vaccine?
As far as I understand, and I've got a call with CVS later this afternoon, but my understanding is that they're going to vaccinate everybody within the facility. And I'll answer the next question. They are going to include, I'm sorry, no, I'm not going to answer that question. um, I thought I was asking about something similar. They are going to include all the staff and residents of the facility. So they're going to try and do 100%. Obviously, it doesn't make sense from an infection control standpoint to have people in the facility that are unvaccinated. If you're trying to control, the outbreak of a disease in a facility. The home health employees, um, if I'll have to take that one back to the way we've done the reporting to the Walgreens and CVS is we provide them total number of employees and total number of residents. For residents, we've really used the maximum bed count. So I'm thinking if there are home health employees that are there that day, there's a potential that they're going to get included. I know local health districts are also looking at how they can include home health employees in their vaccination plans as well. So home health employees are considered phase 1A, and we will make sure that they get included in one of these efforts. But I don't have a specific answer for home health employees at this time.
Thank you. And what about adult day employees?
Talking about adult daycares.
Yes.
Yeah, and again, they're kind of the same in the same boat. So though those employees would fall into that other healthcare worker outside the hospital and the long-term care facility. Right now, the local health districts are working with their providers in their community to determine how they're going to vaccinate these groups. But I don't have a definitive across-the-board answer for you.
Okay. And then another one came in. What is the preventative nature of the Pfizer vaccine? Moderna has been initially reported to have preventative properties, but reportedly Pfizer still has to test this.
I'm not sure what you mean by preventative properties. Their data that they presented to the FDA showed a 95% efficacy on day 7 after the second dose in terms of preventing infections with SARS-CoV-2. They also had some data that suggested that those who do get infected tend to have a lower, less severe illness, although I think the data for that wasn't as strong, mainly because the folks in their placebo group that got the disease, a lot of them did not have as severe illness either. So the prevention for severity of illness is less strong in terms of the data that they have so far. But as far as preventing the infection, the detectable infection with SARS-CoV-2. It's about 95% efficacy for the Pfizer vaccine.
Perfect. Thank you. That's all the questions that have come in, Dana.
Thank you, Melissa, and thank you, Michael. We hope you can continue to stay on as we move into our next discussion with Dr. Jonathan Evans. So I wanted to introduce Dr. Jim Wright, Medical Director at Our Lady of Hope, as he is going to introduce Dr. Evans. So over to you, Dr. Wright, and thanks for being with us.
Thanks, Dana. Thanks for inviting me. It is my distinct honor to introduce Dr. Jonathan Evans. He's a colleague of mine in the world of long-term care and assisted living. He is a former head of the Geriatric Medicine and Palliative Care Unit at University of Virginia and is well recognized in his field with over 100 publications in peer-reviewed journals. Dr. Evans currently lives in Charlottesville and travels all over the country speaking about his passion for empowering patients and families in congregate care settings. And he is past president of my professional society, AMDA. And I am very honored, like I said, to invite him to speak to us today about practical concerns about the vaccine rollout in long-term care.
Well, thank you so much, Jim and Dana. I'm really honored to be here, and I'm a kindred spirit and a fellow traveler. I practice in long-term care settings in Charlottesville, and I'm here to say that we're all in this together, and we're going to get through this together, and we're going to figure it out together. And so I'm mainly interested in answering any questions that you have, but I was asked to talk about a couple of points. And I'll just tell you what those were and kind of what's on my mind, and then we'll kind of launch into things. I was asked to talk about some of the process issues, although my colleagues in the health department did such a great job that I could probably keep that pretty short and just focus on your questions. I was also asked about issues about staggering the vaccine among staff and whether or why that's a good idea, about antigen testing, which was touched upon, and then also about about an emergency plan and so forth. But also, and perhaps most importantly, I want to talk to you about really communication and really how to talk to how to try to convince your staff and your colleagues and to be vaccinated. I'm confident that the vaccination rates among residents are going to be very, very high because they've always been very high, and because the impact is obviously greatest in that population. But I am concerned, I'm very concerned about the potential for very low vaccine rates among staff, and I'll tell you why in a little bit, and just talk some about the difference between consuming information and learning and changing behavior. And what we're really asking people to do here, to be quite blunt, is we're asking everybody to put something into their body that they may have some concerns about. We're asking them to do something they've never done before. And whether or not they do that is going to be based on trust. And a fundamental question that some of you ought to be asking yourself right now as you decide whether to listen to me about anything is, why should I trust this guy? And so, especially if you don't know me. So, and to be perfectly candid, I don't expect you to, okay? So, but having said that, let's talk about some of these practical considerations. And I want to underscore some of the things that were previously mentioned. The vaccine that we're talking about in Virginia is the Pfizer vaccine, and this is without going on all the details, this is an exceptionally safe and an exceptionally effective vaccine. It's using a technology that's not new, but it's the first time this technology has been used in vaccines, where it involves injecting a piece of what's called RNA, or specifically messenger RNA, which you can think of as a blueprint that tells the factory in your body cells to make something, specifically to make a protein called the spike protein on the coronavirus. So it's a piece of the coronavirus, but it's not the virus. It's not the whole thing. It can't replicate on its own. In other words, you cannot be infected with coronavirus from getting this vaccine. Okay, just to be clear. I mention that because some of you, and certainly many of our colleagues and many of our residents, have conditions where their immune system is suppressed, such that they have been cautioned in the past that there are certain vaccines, perhaps those containing a live or weakened virus, that they shouldn't take because there's a risk that they could be infected if their immune system doesn't work very well. That is not the case here. You cannot be infected from this vaccine. And what it does is it causes your body to make this protein, and then and this protein, by the way, is the same exact protein that we test for when we use these antigen tests. Okay, so it was mentioned a few minutes ago that even if you get this vaccine, it won't mess up the antigen test. I'll explain that in a minute, because in effect, there's going to be antigen inside your body at least for a period of time after you get the vaccine. So your body gets this blueprint to make this protein, this antigen. The protein then goes around your body, and your body identifies it, and it attacks it, and it makes antibodies. And these antibodies are stored in your body. Basically, it revs up your immune system so that if ever again in the future you get exposed to the same antigen, you'll be ready for it. You'll attack it before it can cause you any problems. That's the whole concept here. And it's highly effective, as I mentioned. Let me put it in context. If you get this vaccine, your chances of getting coronavirus are 1/20th of what they would be if you didn't get the vaccine. Okay, and what that means is that of all the people in the study that were in the study that got coronavirus, 19 out of 20 of those people were people who didn't get the vaccine. Now, it doesn't mean that if you get the vaccine, you have a 5% chance of getting coronavirus. Your chances are actually much less than that. Out of, let's say, 20,000 people that developed coronavirus, out of 20,000 people that got the vaccine, I got ahead of myself. So you had 40,000 people in the study. 20,000 people got the vaccine. 20,000 people got salt water injected, the so-called placebo. 95% of the people who ever got infected were in the placebo group, but there were only about approximately 10 people of the 20,000 people who got the vaccine that ever ended up getting coronavirus. So most people didn't get coronavirus in the study. Okay. All right. So just a couple other things I would add to what was said earlier. The Pfizer vaccine requires 2 doses, 21 days apart. So if you started vaccinating on December 28th, and for most of us, particularly if you're in AL, it's going to be after that. But if you started on December 28th, that means that there would be a second round 21 days later and a third round 21 days after that. So it's going to be 42 days minimum before everybody ends up being vaccinated in your community. So this is a process that's going to last 1 to 2 months. With the Moderna vaccine, which is very comparable, it's dosed 28 days later. So that would add 2 additional weeks to the whole cycle. And so I'm just telling you as an editorial comment, I'm glad it's the Pfizer vaccine, because when we can get through this faster. Okay. Now there's among the people that got the vaccine, this Pfizer vaccine, 8.3% of them had some kind of minor reaction, as was described in the study. The minor reaction was either muscle soreness, where they got the shot, or they might have had a fever for a day or 2. And if any of you have ever been vaccinated against anything, which is almost all of you, you have probably experienced one or both of those from different vaccines. And some vaccines are more notorious than others for causing that. the rate of fever after the shot was closer to 2 or 3%. So it's not, and I can give you a specific number here in a second, but so it's not that 8% of people get a fever, but 8% of people have some kind of local or have some kind of minor reaction. Now, that's a little bit tricky. If somebody got a fever right after the shot, the first shot, and you don't get full protection until 7 days after the second shot, you can't really be sure, was this fever caused by the vaccine, or is this person unlucky enough to be sick from something else, possibly even COVID? And so if they showed up for work the next day with a fever, they would probably screen out for being able to work based on the screening criteria to try to keep people with COVID out. And so that raises the question, well, if we vaccinate everybody on the same day, all of our staff, will we have enough staff the next day or the next day after that if several percentage of them can't work because they have a fever? And so that's an individual question for each of you. And depending on what the answer is in your circumstance, you might consider talking to the pharmacy provider about having half of your staff be vaccinated on the first day and half being vaccinated 21 days later. Okay? And now, the disadvantage of that is it will take longer for all of your staff to be protected. The advantage is you'll have more staff available. And I've talked personally with Walgreens, and they said they'd be willing to do that. If you happen to be at a CCRC, you may have a little more flexibility because the AL side is going to be vaccinated. Well, they're not going to. Let me just clarify. What you heard was that AL is going to start later than SNF. Okay, so nursing homes first, then assisted living. But it's not going to be 42 days later. They're going to start after sometime after all the SNFs have gotten their first dose. Okay, so the overlap is going to be maybe a couple of weeks. So you could potentially at a CCRC, if you're concerned about staffing, you could potentially spread out the staff vaccination over a number of other dates, because you're going to effectively, there's going to be, instead of 3 dates at your community, there's going to be 6. Okay, I don't want to belabor that, but it's a possibility. And for some of you, that's going to be something that you may want to consider. So I mentioned that if you get this vaccine, your body is going to make antigens. The vaccine causes your body to make the spike protein. The spike protein is the thing we test for when we do our routine testing, especially in nursing homes, to see if our employees or our residents might have COVID. And so, but you just heard that if you get the vaccine, it's not going to mess up the test. Well, how is that possible? Here's how it's possible. Because when we check for antigen, we're checking people's noses, okay, in the back of their throat. And just because you have a protein in your blood or in your body doesn't mean it's going to come out your nose. And the reason it's not going to come out your nose is because the cells of your nose aren't making it, okay? And the cells of your nose aren't making virus, which is what happens when you're, or the cells of your lungs. And so it's believed, this hasn't even been tested yet, but it's basically what you heard is that it's believed that even if you've gotten the vaccine, the antigen test will probably not be positive. Okay, and if it were, it would only be for a short period of time. However, that begs another question, which is, I'm sorry, I'm jumping around here. One question is, okay, I want to convince all my staff to get the vaccine. What incentive is there for them to do that? How can I tell them their life's going to be better? And you might think, well, if they get the vaccine, they won't get COVID, so they don't have to wear a mask. Well, you just heard we can't go there because it's going to take at least a month before they are fully protected. And number two, you can't tell by looking at somebody whether they've been vaccinated or not, and so it would create a lot of chaos if some people were wearing masks and some weren't. And even if you knew the difference and you were okay with that, your residents wouldn't know the difference, and it may cause a lot of distress. And certainly their families would be upset, as you would if you went into a store and people weren't wearing masks, okay? So, but on the other hand, once people get vaccinated, the rationale for doing repeated testing for people who have no symptoms and who've been vaccinated kind of goes away. And I say that confidently because currently what the CDC recommends, and the state as well as a consequence, is that if you have somebody who you know has tested positive for COVID and recovered, they don't need to be tested again as part of your routine screening for 90 days. So one benefit to your staff of being vaccinated, and the residents for that matter, is that after they get vaccinated, I can promise you that pretty soon the state of Virginia and CMS will say, great, now those people who've been vaccinated don't need to have, at a certain point in time, won't need to have repeated COVID tests, okay? So that's a small benefit to all this. All right, I was asked specifically about what do you have to do when the pharmacy team comes in to vaccinate everybody? Do you have to have some kind of an emergency plan and so forth? And so I verified this with the pharmacy providers, and basically this is what they said. This whole plan is supposed to be soup to nuts, the whole works, the whole meal, and they're bringing everything, including cotton balls and Band-Aids and the like. And the only thing they need is a space, and they may need assistance. They will need assistance getting patients or residents to and from the vaccination site in that space. Or if you have people that are not able to come down, if they're confined to bed, they will go room to room, but they're going to need someone to guide them. So they'll need some staff assistance. It doesn't require nursing per se, although that may be helpful. What if somebody has a bad reaction? Some of you may have read that in England last week, a couple of people had a bad allergic reaction. This was not seen in any of the clinical trials, but as you probably know, real life is sometimes different than the environment in, clinical research. And the reason they hadn't seen it in the clinical trials is because in the clinical trials, they didn't include anybody who had a history of severe allergic reactions. They kept those people out. But it just so happened among the thousands of people that they vaccinated in England, there were a couple patients who had a history of severe allergic reactions to other things, okay? Not COVID vaccines, because we never had that before, but these are people that had such a serious history of severe allergies that they carried epinephrine pens with them. All right. So, having said that, in the United States, they have not said that people who have severe allergic reactions shouldn't get the vaccine, nor have they said that in England. They just said those folks should think twice about it. But what if somebody what if somebody has a history of severe allergic reactions, like one of your employees, and you don't know that, and they get vaccinated? Well, first off, they're going to be asked that by the pharmacists, and I'll explain that in a minute, before they get vaccinated. And second, the pharmacists and their team are going to have with them an emergency kit that includes epinephrine, among other things. And they will evaluate. They're going to monitor everybody who's been vaccinated for a period of time afterwards, and if they have a history of severe allergic reactions, they're going to monitor them for at least a half an hour, and they will take responsibility for any kind of emergency that might occur. Okay, so that's not something you have to worry about in terms of your staff. So from a process standpoint, here's what you should know about. So they're going to come to your site and they're going to do it all, basically. They're going to do the vaccination, the documentation, and so forth, but they need you to do some work ahead of time. And the work that they need you to do ahead of time is they need you to talk to all your staff and all the residents or their families, and they're going to need you to begin the process of getting consent. And each of these pharmacy companies has a form they will provide to you in advance. Well, you should insist that you get it in advance. It's going to include, it's called a Vaccine Administration Record, or VAR, they call it the VAR, and it has multiple purposes. It includes the demographic information of the person. It includes their insurance information because they're going to bill for an administrative fee, even though the vaccination itself is free. Giving the vaccine, they get to charge between $15 and $20. It's going to include consent from and that consent, it can be from a surrogate, and it doesn't necessarily have to be in writing, since you don't want all the family members to be coming in at once in your building. So you can simply notate that you spoke with somebody. You put your name, you say, I spoke with this person who's their representative, and they agreed to the vaccine for their mother. And it's going to have a checklist of questions that ask about prior problems with vaccines and stuff like that. I didn't have the presence of mind to provide it today, but I got it online. And CVS has a separate one, and Walgreens has a separate one. So those are something you can look at ahead of time. Yes.
Excuse me, Dr. Evans, some questions are coming in, and I wondered if Dr. Wright might be able to ask you those at this time.
Sure, yes, absolutely.
Yeah, sorry to interrupt, Dr. Evans. Thank you for the information. We have a question about the staggered vaccination schedule in a CCRC. You had mentioned you'd spoken with Walgreens. A lot of our members have heard that our partners at CVS and Walgreens will only visit the facilities 3 times.
That is correct.
However, is it your understanding that those 3 times would be 3 times for a skilled / long-term care and then 3 times for an assisted living facility?
Yes, that is correct. And here's why. Well, so let's be clear. These are companies that contracted with the federal government to do certain things. And specific to that, they said we will come 3 times. So it's going to be 3. It's not going to be 2. It's not going to be 6. It's just going to be 3 for a nursing facility. And they said they will come 3 times for an assisted living facility. So, but it just so happens that in the state of Virginia, like all but 2 states so far, the state of Virginia has said we're going to start with SNFs, start with nursing homes, and then we're going to do assisted living after that. Well, many of you have a campus that includes both. And when I say after that, as I mentioned, the total cycle is 42 days. So day 1 is the first day. Day 22, 21 days after the first day is when they come back to give the second vaccine to people who got the first vaccine on day 1. And that's when they will vaccinate other people who didn't get the vaccine on day 1. And then day 42 is when they come back, 43, excuse me, is when they come back and give the second dose to all the people who got the first dose on day 22, okay? So it's really 2 22-day cycles back to back, all right? So so what I asked about this specifically, they said we're not coming in between times or anything like that. You don't get any extra clinics. But what we could do is we can vaccinate all of your residents at this nursing facility, in this case, on day 1, and then we'll do half of your staff on day 1, and then 21 days from now, we'll come back. We'll give the second dose to all the people who got their dose on the first day, the first dose on day 1, and the other half of the staff that didn't get vaccinated, we'll give them their first dose on that day, which is the second clinic. So that's the only way you can stagger the vaccine within a given setting, okay? However, for many of you, you have staff that might work in the AL and might work in the nursing facility, okay? And so they have the option of being vaccinated when the nursing facility residents get vaccinated, or they have the option of being vaccinated when the AL residents get vaccinated, but they're not going to vaccinate the AL residents at the same time as the nursing home residents, at least not on day 1, because they're going to make sure that everybody who wanted to get vaccinated in the nursing facility had an opportunity to get their first dose before they start offering vaccination to any other long-term care site. But I clarified last night with Walgreens that they don't have to have, that everybody doesn't have to have already had their second dose before they can start on AL. So that means that it's possible that sometime between your first and your second clinic in the nursing facility, you could potentially start your first clinic in AL, and they might overlap in some respects. But you need to check with your pharmacy provider to find out how they're going to do that.
So your understanding is, yeah. So your understanding is it's possible that you could have CVS come in on, December 28th in a CCRC, and then and do your long-term care skilled rehab, and then perhaps a week or so later they would come back to do your AL. Is that a possibility?
To start the cycle in the AL, yes.
Okay.
That's possible, but you need to clarify that.
Okay.
Because I clarified with them that they were not going to finish with skilled nurse. I should say skilled. I realize many of your nursing facilities are not skilled, so I pardon that really broad term. But they basically made it clear that they wouldn't have to wait until the whole 42-day cycle in order to start an AL. So so if you have a CCRC, there's going to be some overlap in all likelihood. Okay.
Great.
But again, and the other thing is you have to tell them in advance. People have to sign up, and you have to tell them in advance how many people are going to be vaccinated on a given day. And so there's going to need to be ongoing communication. I would recommend weekly between your entity and the pharmacy provider to prevent problems and to iron out this kind of stuff as you go.
Right.
What will happen is they're going to call you or email you or whatever at a certain point in time, probably quite soon, and say, okay, we have been given permission to start vaccinating in your community in 2 weeks. Tell us which day in those 2 weeks you want us to show up, and that will be day one, and then we'll come back 21 days after that. And they'll say, how many people do you think you want to vaccinate on that day? And then about 2 days before that date, they're going to ask you for a very firm list. Now they will, in all likelihood, bring a little extra with them, but they do not want to waste precious vaccine for people that don't show up. So in other words, if you're thinking about staggering employees and so forth, you need to be communicating actively and repeatedly with the pharmacy provider to make sure that the numbers all jive. And Dr. Evans, from your review of the literature, and I know all we have is the results from the Pfizer vaccine, your gestalt on this, do you feel that is a necessary precaution to take, given the side effects? Do you feel that staggering staff is really something that's necessary for this vaccine? No, I don't think it's necessary in all cases. I think it's more. It really depends on. It depends on a number of things, including, what your staffing is like. There are some places that are relying on agency staff that may be more difficult if a number of people get a fever. But for others, and especially if you have some flexibility across a big campus, that may not be an issue at all. So, I'm encouraging everybody I know and love to get vaccinated and to get vaccinated as soon as possible. And I can speak more to that in a moment.
Okay. What about, we've got a question about references that you can refer people to, specifically a question about if people have already had COVID,
yes.
Where can we refer them to for recommendations to go ahead and receive the vaccine? I believe there's the CDC has some guidelines.
Yeah, so it's a very important question. I might point out that the President of the United States, who did have COVID, announced that he was planning to get the vaccine, for what it's worth. But so first off, this is the first and only time that I'm aware of where a vaccine was authorized under an emergency use authorization versus a different process, which is called FDA approval. And with FDA approval, the government is a lot more strident and much broader about their recommendations. But because this is such a serious public health issue, they decided to not wait for additional data and to authorize it somewhat early. The FDA authorization authorizes this vaccine for anybody 16 years of age or older in the United States, regardless of whether they've had COVID. There is no, in the emergency use authorization, there are no exclusions. They didn't exclude pregnant women. They didn't exclude people with COVID. But they also didn't say we specifically recommend that every pregnant woman get this or anything like that. So there weren't people who were pregnant before the study weren't included in the study, but many women during the study became pregnant, not because of the vaccine, I'm certain. So, so there's several different documents to be aware of. There's this document called the Emergency Use Authorization by the FDA. If you Google FDA EUA COVID vaccine, it'll pop up. I did that myself. Similarly, there's a publication that was referred to by my colleague from the health department that's published in the MMWR, which is Morbidity and Mortality Weekly Report, the weekly report by the CDC. Google MMWR CDC COVID vaccine, and you'll get that document. It has some additional information. And in addition to that, the CDC has a lot of other guidance on its website. Now, the actual Pfizer study that we're talking about was published in the New England Journal of Medicine, and I can give you that reference. It was published on, one second here, I got it right here. The first author is P-O-L-A-C-K, and it was published on, let's see.
I think it was published on the 10th.
Yeah,
Jonathan,
I was looking for that on the paper.
Yeah, I'll put the reference. I have it in the chat box for anyone that's interested.
And that's free to download. You don't have to be a subscriber. It's obviously very detailed and technical, but that's the source document. Now, the thing about it is the FDA, so the issue about COVID vaccination, or if you've had COVID before, is simply this, that they did not include anybody in the clinical trials who had already had COVID. And so they can't prove how much better or worse it is in people who had previously had COVID who get the vaccine. But there's a concern and a belief, and it's not limited to just this condition either. There's a concern and a belief that just having COVID alone may not provide very long-lasting or very good immunity, as evidenced by the fact that some people have gotten COVID more than once with different strains. And similarly, there are other vaccines out there, like the vaccine for shingles, that's recommended for people even if they've already had shingles. So this is not a big stretch. The belief is that the vaccine itself will result in a more robust and hopefully longer lasting immune response than the original infection, at least for some people. And part of the reason that people are so enthusiastic about that is because the vaccine, number one, the vaccine is incredibly safe. And number two, this, and I can't underscore this enough, the problem that we're facing is way, way worse than anything else we've ever experienced as a public health emergency in the history of the United States. And the thing about it is that there are many of you on the call who, generally speaking, avoid vaccines and maybe avoid them for your children, okay? The thing that, and I'm not telling you what to do, but the thing you need to be aware of is that if you don't get vaccinated against measles or the flu or something like that, your risk of getting sick and dying, or your kids getting sick and dying, is actually quite low regardless, because there is no measles pandemic. There is no influenza pandemic. And so your risk of exposure is very, very low. But there is so much COVID out there right now that if you don't get vaccinated, not only are you much more likely to get infected, but because you might say, well, that doesn't matter because I'm young and I'm not going to have any symptoms. And so big deal, I'll get it and I'll be done with it. The problem is if that's what happens to you, you won't know that you had it. You won't know when you're contagious, and you'll go about your business and you will expose other people, some of whom you may not even know, who could get sick and die, and you'd never even know it.
Excuse me,
Or
Dr.
some
Evans.
of them could be, yeah. Yes.
I'm very sorry to interrupt you, but we have about 5 minutes left, and I just
Sure.
wanted to make sure that we get to the chat box with Dr. Wright.
Oh, sure. I'm sorry. I didn't mean to rant and rave. I'm done with all that stuff. I'll answer the question.
Okay,
Sorry,
thank you.
Yeah, great. Thanks, Dana. So,
Yeah, sure.
Dr. Evans, one question was going back to a previous comment you had made about CVS and Walgreens coming in and providing a kind of a soup to nuts vaccine clinic. But the one question that some of our members had was in preparation for a possible anaphylactic reaction where we would potentially need epi or at least Benadryl or something like that. Is it your understanding that Walgreens or CVS would have that in their toolkit and be able to administer that, or would that be up to individual facilities?
No, just that's to be explicit. They are providing an emergency kit with epinephrine and with Benadryl and they were providing staff on site, including a pharmacist, who are trained and licensed to administer it.
Good.
And there is a process in place to monitor people after vaccination. In some instances, like if it's somebody they vaccinated in their room, they may not stay in the room for 15 or 30 minutes, but they will ask you to keep an eye on them and to let them know if there's a problem.
Very good.
Otherwise, they will keep people in the vaccination room in your public room and watch them until a certain amount of time has passed.
Okay, great. And we have a time for maybe one or two more questions. Question from James, full protection from the virus after the vaccine starts about 7 days after the second dose. Any thoughts about how long protection should last? Yes. Is there any data yet?
No, there's no data yet. Nobody knows how long it's going to last. For the other vaccine, it's expected to be 7 days after 28. So this is a little shorter. I mean, it will happen sooner. What that means is that there's probably some protection right after the first dose, but it builds over time. The people that were in the clinical trials are continuing to be monitored in order to see if they develop COVID, in order to figure out how long it lasts. In addition to that, there's an ongoing monitoring program for everybody that gets vaccinated to keep track of adverse effects as well as if people get COVID. So that so that's an easy problem to solve over time, or easy question to answer. And the answer to that question will result in a decision about whether or not people need to be vaccinated again, say every year or every couple of years. But it's going to take time to figure that out, and there are active measures in place to monitor that over time.
We'll be excited to see that data.
Yeah.
All right, I think that's all the time we have. I'm going to turn it back to you, Dana.
Thank you. Thank you, Dr. Wright. And thank you so much, Dr. Evans. We do just have a couple of questions. A couple minutes left. So I just wanted to open it up to see if there are any remaining questions. You can put them in the chat box or come off of mute. Okay, well, hearing none, thank you again, Dr. Evans. Thank you so much. We really appreciate it. And thank you, Dr. Wright.
If I could just make a last comment.
Yes.
The reason why I wanted to talk to you today is because I appreciate what you all do under very difficult circumstances, never more difficult than now. And many of you, all of us together, have a tendency to be blamed for the problems that we're often the only ones that are willing to accept any responsibility to try to fix. So I just can't underscore enough the importance of your work, of your mission. And this is your time and your moment. And I am very grateful to each of you for accepting this responsibility and challenge. And I just want to say it's part of who you are. Don't ever underestimate the difference that you make every day. And I would encourage each of you to think seriously about being vaccinated, but don't get vaccinated out of fear.
if you decide to get vaccinated, do it out of love for the people that you love, to try to keep them safe. And I'm confident that together we will get through this. So thank you for including me, and I appreciate your patience with me.
And Dr. Evans, we do have some questions coming in, if you still have a
Sure.
minute.
I've
Thank
got
you for
time.
those kind words. It's very nice. Question, I'm the healthcare administrator of a nursing home. Should we be reaching out to our contractors that work with their residents to include them in our testing? If they are not included, my understanding is that they would not be in the same phase as our actual employees. Examples include hospice staff, ambulance drivers, private duty, and lab techs, etc.
Yes. So so that's a very important question. It's also a way to get vaccines into independent living, but that's another story. But here's how. So as a technical matter, for every licensed bed that you have, the pharmacy has been allocated a vaccine for the number of beds, and in a 1-to-1 ratio, an equal number of vaccines for staff. So if you happen to have, let's say, a 40-bed nursing facility, you'll be allocated 80 doses for that. If you have 200 assisted living units or beds, then you will have 200 for the residents and 200 for additional staff. Now, assuming that the staffing is lower compared to the nursing facility, if it's lower in AL compared to the nursing facility, you may actually have some extra, okay? But so I'm just letting you know how many have been allocated for you. Then what's going to happen is the pharmacy is going to say, okay, this is how many have been allocated. How many do you really need? Maybe you're not very full or something. And, knowing how many you can get, you can decide whether you want to offer that to these other folks. And I would encourage everybody who comes onto your property to be vaccinated, because if they're not, those are people that are at increased risk of bringing it in and spreading it to everybody else, including the people that have not yet been vaccinated but really want to be vaccinated, as well as those who said no. So it's possible to do that, but they won't be vaccinated unless you add their name and have them sign up basically under you.
Thank you. Thank you so much, Dr. Evans. Well, thank you
Sure.
everyone for joining us today. As a reminder, there will not be any calls for the remainder of this year unless we have new developments. We'll schedule a call and certainly let you know, but there are none scheduled for the remaining part of the year. So I hope that everyone has a wonderful holiday, and please reach out to us for any questions that you may have for any issues. We're here for you. Thanks so much.
Thank you. And I'm certainly happy to stick around if there are more questions, but I'm sorry to hold you hostage.